see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
Hello, everyone. A very good evening to all of you. Welcome to the KHA Homeopathy Study Group webinar for today. I, Dr. Yashika Arora Malhotra, welcome you all to the webinar of today of hosted by a Kavita Holistic Approach for the February 2026 month. So today we are gathered here to discuss on the topic that is from warts to abscess, miasmatic expressions in homeopathy by Dr. Archana, and pelvic floor and low back importance of posture and stress correlation by Dr. Sayalee. We have our speakers of the month on board. So I welcome both of them, Dr. Archana and Dr. Saili, with us. And also now I would like to request Dr. Richa to please read the code of ethics of our car study group. Over to you, Dr. Richa.
Thank you, Dr. Yashika and CAR Study Group for giving me this opportunity to read the Code of Ethics. Can you please share the screen? Is it possible for you?
Yes, ma'am. Yes, ma'am.
Dr.
I'm
Yashika,
about to share.
can you
Yes,
share
ma'am.
the?
Yes, ma'am. Yes.
KHA, CAR Homeopathy Study Group Pro Bono, Ethics and Benefits. To be a KHA speaker needs at least 1 to 2. The screen is not visible.
One minute, ma'am. I think it's yeah. It's visible?
Yeah, okay. To be a CAR speaker needs at least 1 to 2 months of active volunteering. Only CAR speaker themes are promoted in newsletters and webinar. CAR provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on CAR website, newsletters, and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for CAR international talks. Volunteers are eligible for case discussions. CAR promotes homeopathic organizations as well as their mega events. CAR promotes great work for speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. CAR maintains a healthy and happy environment, so keeps only like-minded folks. CAR requests everyone to maintain the confidentiality of the group. Over to you, Dr. Yashika.
Thank you so much, ma'am. So here we proceed with the seminar. And further, I would like to invite our speakers of the day. We already know that we are going to discuss the topic that is from warts to abscess, miasmatic expressions in homeopathy. And our first speaker of the day would be Dr. Archana. I would like to share a few details about her. She is practicing since last 20 years in classical homeopathy and counseling. She is the founder of Ishwara Homeopathy Clinic, Bangalore, and also the executive member of the doctors panel the Karnataka Qualified Homeopathic Doctors Association. She is the former senior consultant. She was the former senior consultant at Dr. Batra's Homeopathy and Life Force Homeopathy. She has special interest in chronic skin conditions and miasmatic case analysis. Also, her additional interest and contributions include strong interest in arts and creative expression. She has been the author of two drawing books that are available on Amazon. She actively creates and sells artwork with proceeds donated to a charitable trust. She integrates art, healing, and social responsibility in her professional practice. So I would like to welcome her to the session, and I would request her to please take over the session from now and share us the clinical cases you want to share on Warts to abscess and their miasmatic expressions, the miasmatic understanding of surface pathology, and a Kantian approach to proliferation and suppuration. Welcome, ma'am. Over to you.
Thank you so much, Dr. Yashika. It was really a nice introduction. I really feel overwhelmed when you talk like this about me. So, first of all, I thank Master Hanneman for giving world the beautiful science of homeopathy, which helps us heal patients gently and naturally. And we all continue to follow the path that he has showed us. And I also sincerely thank Dr. Kavita for creating and caring for this study group. And I've seen, she always has her love for all of us. So without wasting the time, we will start with the session. Just tell me if you can see my screen. Are you all able to see my screen?
Yes, ma'am.
And yes. So this is just a small PPT that I'm sharing with you, few cases that I have seen in my clinic. And like all of you, I'm also learning and will continue to learn in this ocean of knowledge. So if there are any mistakes, please pardon me, and would take all the questions at the end of the session. So this is a disclaimer that all the KHA Homeopathy Study Group webinars are for educational purposes and not intended to diagnose or treat a disease. Listeners can benefit with the information at the webinars, and the opinions expressed by speakers, moderators, and attendees are part of the educational experience, and they do not necessarily represent the position of the Kavita Holistic Approach, KHA or KHA Homeopathy Study Group. So, as I said, we sincerely thank our Master Hanneman and our Dr. Kavita, who has, as in this picture, you can see just holding a motherly, loving child. And she has brought all the doctors together in this forum and supported everyone. So, like she always says, building a temple of devotion and you get prasadam. So, because of her efforts, many doctors feel connected, confident, and, connected to each other. So, with grace and gratitude, I start this session. Now, as you can see in this picture, this is the state of health. As you can see that this is the tip of the iceberg. Most of the diseases that we see in our day-to-day practice are also a part of understanding that disease is not just what we see, but there is more to go and dig beyond. So I will be talking in this session not only just what is visible, but as a homeopath, what we work beyond this. So you can see that there is a lifestyle behavioral level and there is a cultural psychological level of problems that are beneath, and also spiritual being. So the disease does not appear suddenly. As you can see that one patient is getting a skin problem or some patients are getting rashes. So there is nothing which is suddenly. Of course, there are some sudden onsets, but there is some process beyond it. So as you can see in this picture, there are certain miasms that we need to understand. When we are seeing any patient in our practice, we have to understand not that it is the skin, but how that disease has evolved, like the how the pathology has evolved, and how we as homeopaths must learn and see beyond the visible lesion. So, as our Dr. Kent has said, chronic disease is the result of a long continued disturbance of the vital force. And also, we see, as per Dr. Hanneman's words, chronic diseases arise from chronic miasms and they develop gradually. So, there has been some or other point where the patient has got affected, maybe in his personal life, maybe in his work, or maybe some other things that he has not been able to be. with dis-ease, that is not in the ease. As you can see in this picture, there is a wart, and how this wart progresses to abscess. Like this is a raised rough skin growth. It becomes into an inflamed wart. And when it is swollen, it becomes into infection and slowly it turns into abscess. So here the progression chart, you can see that it also depends on the depth, the size, the number, and the common sites. In boils, basically, you can see that the boils don't need any treatment sometimes. They just drain itself. Whereas a furuncle needs to be opened. In abscess, what happens is, though after the draining is done, it still needs a treatment because it may reoccur. So this is how we our homeopath's role come, and it is not just to remove the pathology, but to understand how it is formed. So there are three cases that I'm going to discuss with you. This is the first case where you can see there is a small round P-shaped lesion on the right foot. It is a solitary lesion, and as you can see that there are certain secondary infections above it. So this is a case of a girl who had this P-shaped growth on the right foot, and she had a tuberculosis in the 10th standard. In general, she had desires for sweet, she had thirstlessness, she is a hot patient, and apart from that, in the menses, she has cramps only on the first day. Now, here the mind body link is that she is a software engineer, and as in Bangalore, many of the people are just worried about the deadlines and the new upcoming problem of AI, that how the jobs would be secure, and also about her marriage. So these are the normal tensions that she has. Overall, she is a very diligent person with a strong willpower and also very resilient. What I found in her case was that she was not having any problem with it, but it's just that it was giving some trouble while walking. It was not that she was having pain or radiating kind of affection or pus coming out. Apart from that, she is a very disciplined girl, and she was not opening up very easily. So this is what the repertory totality I had taken. P-shaped growth, then hot patient. She has marked thirstlessness and strong desire for sweets, and also menstrual cramps on the first day. Now, this may be a very common symptom, but for her, it was characteristic because it is her own symptom. And that is why I had taken it in the repertory totality. And also, she had anxiety about the future, which we discussed. These are the symptoms that I had taken. And as you can see, that total approximately 500 remedies were coming into my mind, out of which Lycopodium, Sepia, Nux vomica, Merck, and Pulsatilla were marked. Now, this could be anything, like when we have any such cases in the clinic, what would you generally do? Can somebody in the audience tell me what remedy comes to your mind? You can just type in the chat box. Like which remedy comes in your mind? Remedy like puja, calcarea, or lycopodium. Just think, no right, no wrong. Anybody? Dr. Yashika, is anybody writing something?
Sorry, ma'am.
I said, is anybody writing something like what
I
remedy?
will stop the annotations. I think the annotations are on, ma'am.
Acha, okay. So can you see anybody writing like what remedy comes to your mind from this case?
Oh, oh yes, ma'am. No chat is available, ma'am, right now. Nobody
Oh,
has wrote yet.
okay, no issues. All
You can
right.
see in the chat, in fact, yourself also.
I
There
think,
is
yeah,
no.
drinking lots of water. No, I
Yeah,
was
drinking water.
asking, yeah, like what remedy comes to your mind from this description that we have and the repertorization? What you would give if you were in the place of mine? Okay, I think nobody's writing, right, Dr. Yashika?
No, ma'am, not yet. Only drinking lots of water.
What do you think? What do you
It
think?
She's requesting, Dr. Harshita is requesting to show the previous slide.
Okay, okay. Yeah. It's just that I want to keep the session little interactive. Yeah, who has requested that earlier slide? Okay. All right. Dr. Yashika, any remedy coming to your mind? Okay.
I would like to request the audience to please participate and share your inputs.
All right. I think there is nobody. So we'll go
And she's
ahead.
saying staying hydrated, doing meditation for being stress free.
Yeah, but we are talking about remedy, right?
So yes, it's an hot patient, ma'am, thirstless, strong desire for sweets,
Mm-hmm.
menstrual cramps, anxiety about future. So when you think about and P-shaped growth in the right foot. So when you think about there are so many medicines you can we can if we go for thirstless there are so many remedies. Hot patient, so many remedies. Strong desire for sweets, lycopodium, sulfur. Cramps
Correct.
on the first day, anxiety about future again, lycopodium, mentally very diligent, strong willed. So there
So
are
what
so many
remedy?
things. Yes, ma'am.
Okay. So what remedy can you think of, like in this case, if you were there?
Alicia is also one of the good remedy. It is a hot patient, right foot involved है,
Mm-hmm.
diligent,
Correct.
mentally diligent है, strong willed है.
Yes. That mental picture was the same. When I saw this patient, I thought to give her Silisha and finish up the case. But when I repertorized this, no, I was just shocked to see this. That you can see Silisha is pushed behind. It's not even in the first four. And I have taken not only Kent, I have taken complete repertory rubrics also. Because in complete, there are more number of remedies. And in Kent's, you can see hardly five remedies are there, thoughts, future. So that was little confusing for me to go for this or not, because this patient's totality was more towards sepia. You can see sepia is covering 12 symptoms, which is the highest amongst all. But the patient itself was not looking like sepia. And again, there was a question what to give because the miasm was psychotic. And in antimproved also, the psychotic miasm is there. But lycopodium has this tubercular miasm also. And she has a history of tuberculosis. So that was literally standing out. Other things that you can see is ambitious intelligence that is also there in Tuja. However, growth, if you come to, you are automatically going towards Tuja. So just one rubric that I had seen that she was continuously saying that, ma'am, it is painless. I don't have any problem. It is just painless. I cannot walk and do my work. That was the only thing that she was continuously telling. So in all the rubrics repertories in Zoomio software, I searched for this rubric and only one repertory I could see this, that is Murphy's repertory. If you see in Murphy's repertory, there are so many rubrics and there are single remedies which are so important. See, I had taken the skin, growths, condylomata, and it is a painless. Only one remedy is coming, that is lycopodium. And I was also not sure about lycopodium, but I also found that there are other modalities like, psychosis, tuberculosis, intelligent, achiever, anxiety before performance. She was ambitious because she has traveled all the way from north to south all alone. And she was able to take care of herself. But she had a lot of performance anxiety and also the painful menses which she had narrated. So I had given lycopodium 3 powders and kept her on HCl. And the patient was also given Tuja. She also had some acne issues, and surprisingly, they were also cleared, as you can see in this picture. So, what I can see is that there are certain accidental cures also. Sometimes when the remedy is right, even if you feel that it is not matching as per the totality, or you feel that it is not what exactly it is, but it can cure the case. So this is what happened in my case, and you can see the patient in her own words. Pragya, for the acne marks on the face as well as I hope you are able to hear. Both are reduced to a great extent after using the homeopathic medicine for almost 2 to 3 months. And I can see the great difference in this thanks to Dr. Archana for all her care and all the medicines. It was really good. And you can see the improvement in the face. And you also. I hope you were able to hear her. Hello. I hope you were able to hear her, Dr. Yashika. Also had a corn on your legs, no? Yeah. So there was a corn on my leg, and it is totally removed now after using the medicines. Like there is no mark also of that. Small corn was. So yeah, this is the case, and you can see that the patient's P-shaped lesion has been cleared out, and this shows that not only the patient's uh, problem that is there in the external level, the internal malady is also cleared up. Now, this patient was able to walk comfortably. There was the stress that she was having, it was reduced. She was looking very calm and confident. And also, you can see the homeopathic medicine that she has been carrying. So, what we can learn from this case is the importance of remedy choice, what remedy you choose, and just sticking to that. There was a tendency to form the growths, which sometimes you feel only Thuja can help, but there is constitutional required in this. And the miasmatic interpretation I had taken was psychosis. So single well-defined growth on the toe suggests a psychotic miasm. And this is how the case was cleared. So what we come up to is it is often the outer expression of the internal medicine, internal imbalance. And we should always look at the totality of the patient, not just one thing that is coming. Now, going ahead with the case number 2, this is a case of 11-year-old girl who walked into my clinic with a complaint of a small abscess. And you can see that there is a pus with a small vent. She had a tendency to this abscess, and the mother was worried because again and again she is getting such problems. She had a history of menorrhagia, headaches, and also constipation. She also had anxiety, nail biting, and withdrawal behavior. Now, what do you mean by withdrawal behavior is the person doesn't like to mix with others. And whenever there is something, the patient likes to go away or sit away from everybody and doesn't want to be into that. So earlier, her mother thought that this is normal and natural, but slowly, this behavior was very characteristic. Now, when you are in this clinic having this local symptoms, menstrual troubles, anxiety, and a peculiar nail biting, what would you do? Like, first of all, would you focus on the abscess or you address the deeper child? I want somebody from the audience to talk about it. Like, what would you do in that case? Can anybody answer this? Like, would you focus only on the abscess or the address the deeper child when you have such patient with you? Anybody? Dr. Yashika, is somebody answering in this? Okay, so I'll go ahead. We can see that in this case, there are two remedies very highlighted. One is silicea and one is nitric acid. You can also see calcarea sulf, hepar sulf, lachesis coming up. But whenever any abscess comes to you, you think of two very prominent remedies, that is hepar sulf and silicea. Now, how to differentiate between these two? is that Hepar is a classical remedy for touch sensitivity. Means the person is very sensitive to touch, and it's used in the early stages of abscess when the abscess is just starting or developing. And Silesia, as you all know, is a surgeon's knife. Like, it's a master remedy when abscess is matured, pus builds up, and the system needs support to expel. So in this case, you can see picture was for both. First is the Silesia, means the patient was having the tendency, and the stage that she had come to me was Hepar because this is a classic remedy, and the patient was not allowing her to touch. So as I can see, somebody is not can guess a remedy. You can just put it in the chat box. What remedy you can think of, and you can consider the whole totality again. Here you can see that the abscess was there, and there was also headache. She was also having headaches and profuse menses, menorrhagia. Now, she was a very young girl with a very characteristic history. Her mother had been a single mother. Her mother had got divorced and had shifted to another place, and there was a lot going on in her life. And this child was left alone the whole day. So this thing came up, and her mother was also not aware that how she got it. And when you had taken the whole history, I had taken three very important things because sometimes we are not able to get the mentals of the patient. So at that time, what you can do is you can just rely on the physicals that the patient is getting, which are very characteristic. In this case, nail biting was there, headache was there, but along with that, the patient also had a symptom of abscess. So, as you can very well see, Hepar is nowhere in the picture. It's Silesia, and it is covering almost six of the symptoms that I had put. So, without wasting my time, I had given Silesia to this patient. And also, I had given Calcarea sulf as a biochemic because it works wonderfully in such cases. So this was the photo before treatment. You can see that it's in the starting of the month of last year. And within 1 month, this patient had cleared out with the abscess. Now, what you can see in this case is sometimes the nature also tries to cure the abscess, and we should not interfere in this way. But when homeopathy should be given is when there is a tendency of it, like, this tendency was settled, and now the mother says that no time there has been any abscess to this. So in day-to-day practice, we do get such cases where we just not only focus on the single visible swelling, but try to understand what is the pathology behind it, and also try to understand the child which is experiencing it. So not only see the pain, but also understand what must be going through this. And as you can see in this slide, you allow the nature to complete the healing process. This is a very interesting case of this person who is having a single solitary wart near the eye. As you can see, it's a very small wart, like, very like a Q-tip or like a earbud kind of size. But he was very much, stressed with it, and he wanted to remove it. He didn't want it to go and cauterize it because he was very particular of the marks. And since it's a very cosmetic and sensitive area, he was not ready to go for any other procedure. So there it shows the fear of procedures this has. There is a physical generals. You can see the perspiration in the scalp, scanty thirst, thermals. He was a hot patient, desire sweet. And in mind, he was at the managerial level, but he also wanted company. He was aggravated when there was a single contradiction, and he loves to travel. Whenever I asked him, he was never in Bangalore, he was always traveling, but he wanted to get rid of it. So whenever I called him for follow-up, he was always there. He also had a past history of uric acid level going high in 2024. So he was worried if that is the reason. As you can see in this picture, these are the common types of warts that we get. First is the common single solitary wart. The second is plantar warts, which are very painful. Flat warts, as you can see the flatness of these warts. Pilliform warts, like they are straight, vertical. Genital warts, and also mosaic warts. So these are the types in which our patient fits in the first and piliform wart in both of them. Now, what psychology goes through is that it is an external expression of the internal imbalance. And again, this is also psychotic miasm, purely psychotic case, but there is a tendency of accumulation again and again. that this patient was not expressing himself so much, but he had a lot of unresolved emotions with him. And he was on a managerial post, so he could not even show them. So we wanted a remedy that could focus on the correcting of the internal imbalance rather than just removing the wart. As you can see in this case, like in this slide, that if there is a suppuration, which is of psoric origin. But when the same progression happens at deeper infections, it can lead to psychosis, kind of abscesses. Now, the same suppuration, if it is chronic, it can go to lymph nodes. It can create a lot of ulcerations. And if it goes to deeper destruction, that is syphilic level, we get necrosis and sepsis. So, ignoring suppuration can lead to deeper illnesses. Now, in this patient, it was a wart near eyes and eyelid area, very sensitive, and the case was coming towards Thuja because we all know Thuja is very good in such conditions, isn't it? So I just looked at the totality and gave Thuja for him. And also, you can see that the clinical direction was given that avoid touching, avoid scratching, and rubbing the wart, and the self procedures that patients use, no, like cutting or burning attempts, maintaining good facial hygiene without excessive washing, and if there is any change in the wart size or color, to report us. So I had started with Thuja. And why Thuja was there? Because there is a tendency, there is a history, that's a fixed inward emotional state that everything is fine and recurrent, like this condition was coming again and again. So this was it, and I waited and waited like all homeopaths do, and there was no effect for 2 months. There was no change. So this patient was getting anxious, and it was a thing that we had a challenge into. So I went back to our aphorisms, and as you can see in aphorism 252, where no change is seen, if no progress is observed after a reasonable time, the remedy is not the right one, and the case must be reviewed again. So instead of blaming the remedy or the patient, careful review is all needed in this case. So I retook the case and I re-recorded the symptom list. So Murphy is the favorite in this case because you can see all the clinical rubrics are here. This patient had uric acid diathesis. So I had taken this as number one. Then Warts, perspiration, that is his own symptom. And he had a company desire for, though he was a managerial level, he wanted company. You can see there was a new Wart also coming up, which he did not tell me. So this way I had taken the case, and the remedy repertorization was again Lycopodium, Calcarea cow, Kali sulf, Sepia, Pulsatilla, and Causticum. Now Causticum was fitting very nicely into this case because you can see the face warts are covered by Kent as a 3-mark rubric. And also you can see in Causticum, all the rubrics are taken into consideration. However, the case had totality with Lycopodium. And again, there was a differentiation. Now, Thuja we had given and we could not see any result. Natromur also was coming to my mind because he was having a tendency of, cracked or dry lips. But Causticum also was also coming to my mind because there were larger kind of hard warts in this case. Now, why Lycopodium fits this case? Because in the synergy in chronic cases from suppression to expression, mind-body interconnection was seen, and Lycopodium was acting very nicely at mental and metabolic symptoms, plus the uric acid diathesis. So other symptoms like ambition, anticipatory anxiety, desire for company, strong craving for sweets, hot patient, and the digestive metabolic tendency of uric acid diathesis, as we all know, were there in Lycopodium. Now you can very well see in this picture, slowly this wart shrank into size, and it was absolutely removed in like a matter of 2 to 3 months. So why we come to this slide again is that this patient had this tendency to see this small wart as a big thing. And also you see that this patient's miasm was also coming from psora to psychosis. He was not restless like a tubercular miasm, or there was nothing like syphilis. But what we can see that there was a sense of responsibility in this patient. So as you can see in this chart, psora is mostly about anxiety, stress, sensitivity. Psychosis is more about the growth tendency, and tubercular miasm where the patient has always has this pressure to perform. In my patient, I could not see this tubercular miasm. And when supported correctly, the disease expresses outwardly than inward. So, what we understand from all these cases is that the local pathology is not the disease. You should always support the patient, always allow the outward expression, and the healing follows the direction that is inside and outside. The patient is healed inside, the external expression goes. So, here we come to the end of the session from what to abscess, and as I could just sum up in this picture, the Wart imbalance, abscess at the deeper suppression, and always there is some mind-body link with it. And what we have to understand with homeopathy that there is the mind and body going together, even if there is just outwardly picture. And we have to find out what we have to treat in this patient, and that is what is important. So thank you everyone for joining my session. And thank you so much for joining at the end and wish you all the best. Over to you, Dr. Yashika.
Thank you, ma'am.
Yes, ma'am.
Yes, ma'am. Yes, ma'am. So, thank you so much, ma'am, for a wonderful presentation, case presentation. I think people really enjoyed. There was an interactive session with everybody, and we have another speaker with us on board. So, I would like to welcome ma'am to our second speaker to this session. Before that, I would like to introduce her to the study group and all our audience. So we have Dr. Sayalee Pete, a physiotherapist who believes that pain should be understood, not ignored, rushed, or temporarily masked. She founded Vyayam Physio to create a space where physiotherapy is honest, science led, and focused on long term results rather than quick fixes. Her work is rooted in detailed assessment, evidence-based treatment, and helping people understand how their body actually moves and heals. Instead of generic exercise plans or symptom-only treatment, she focuses on identifying the root cause of the pain, correcting movement patterns, and building strength and confidence in the way that fits real life. Every treatment plan she created is personalized, realistic, and designed to support sustainable recovery. Whether someone is dealing from chronic pain, recovering from an injury, or struggling with posture or work related strain, or simply wants to move without any fear, her goal has always been the same, that is to help them trust their body again. She helps people rebuild movement, independence, and confidence in their own bodies. She is here to guide us on the specific topic. I would like to welcome ma'am. Over to you, ma'am.
Right. Am I audible?
Yes, ma'am, you're audible.
Yeah.
You can share your screen.
Yeah, thank you. That was a big boost
Welcome.
for motivation. The introduction really helps you calm the nerves. So, hello all. I'm sharing the screen. Is it visible? Hello. Is the screen visible?
Yes, ma'am.
Yeah.
Please do it full screen.
Yeah, yeah. Okay. Uh, so let's talk about pelvic floor and low back pain. The reason behind me choosing this particular topic in particular, or in why pelvic floor is often what I get asked. So it's not just, I'm trying to explain the low back pain from a different angle, not just the bones or muscle, but how your posture, your stress, your mind body connection influence the pain. And it is commonly seen with the stress that we are carrying now. So this session is particularly designed for both doctors and patient. So I'll keep the language simple but meaningful. For any doubts, please you can post them at the end, or we can have an interactive session. Q&A is a quick session at the end of the slides. Okay. So why this topic? The importance of this topic. So prevalence of pain is what we have commonly seen. Low back pain is affecting millions worldwide, making it one of the most common conditions impacting daily life overall. Also, this tells us the issue is rather functional than being structural or mechanical as we see today. So, being a physiotherapist practicing for past 12 years, it is very, very easy and in high numbers that I'm seeing patients coming up with low back pain, be it male or female, and especially even the homemakers. So, it is not only the desk workers or office going who have the low back pain, but it is generic and it is seen in all. So many of them go through X-rays, normal scans, go around multiple doctors, but still the pain is the results are okay. They go ahead with the painkillers, muscle relaxant, they find a temporary relief, but it comes back. So there is always a physical and health and emotional well-being related, and the interlink, which is a complex interplay, and that is why we should understand why pelvic floor and stress are related. So self-reflection. So questions what we generally should be assessing. As I ask these questions, I really want everybody as a doctor or as a patient for you to reflect honestly that many people just notice their pain it generally increases whenever you have stress, whenever you're sitting long, whenever you're standing long, holding something, or just emotional overload. So, any sort of overload, be it physical, psychological, or emotional, this patterns gives a very important clues about what the real drivers for pains are. And when taken into history, it actually helps us assess better along with assessment of stress, which is now being a key to assess your low back pain and neck pain. So, what is pelvic floor? Pelvic floor is a group of muscles which is at the base of pelvis. It is like a foundation for any building or any strong apartment or house, and it supports the organs, very important organs like your bladder, your bowel, your uterus, and it works automatically without us thinking. It is very much in sync with your brain, your heart, and your body and mind. It is also it plays in a role in your posture and spinal stability since it is the foundation. So everybody knows now, everybody works on their core, but core also has so if you consider core as a cube or as a square, the top is like umbrella structure is your diaphragm. The front is your transverse abdominis, obliques, or the stomach muscles. Your back muscles or deep flexors are what are on the back side of it, and the base is what is formed by the pelvic floor. So if you consider this, then whenever you strengthen your core or whenever there is a pain associated, you understand that it is a dysfunction or a mechanical issue or a stress related that you're holding on between all of this. So pelvic floor's role in stability, as I told you, pelvic floor does not work alone. It functions with diaphragm, abdominal muscles, and your deep back muscles. So think of it as a pressure system. So when one part is disturbed, the whole system gets affected, and majorly your pelvic floor. So since nobody actually pays attention to strengthening your pelvic floor, it is always out of sync, and hence it does play a crucial role, but is often ignored. So how does the pelvic floor support your low back function? So before we move our arms or legs, the pelvic floor and core muscles actually get activated. They stabilize and when not just your spine, but also your lower limb and your thorax. So when this coordination is disturbed, the low back starts taking excessive load, which starts with stiffness, maybe discomfort, and further leading to pain over time. So it is very important in stabilizing the spine. That spine stability and a stronger foundation helps you sync all the entire movement around spine, be it upper limb, lower limb, or thorax. Since I do take ergonomics lectures and I do promote how to sit correctly, but have often seen even myself that whenever we are in focused or too much focused, we tend to slouch. So our shoulders are rounded, we tend to bend forward, and the slouch sitting generally is one of the poorest posture that we see today. So slouch sitting will make your pelvic floor in constant tension. It is always holding on, which also reduces your breathing efficiency because your diaphragm doesn't work to its maximum. And over a period of time, this creates a strain between your lower back muscles. Since they have to hold the pelvic floor and or your diaphragm, this will keep giving you pain either in your neck, mid back, or low back. So effects, this reduces your spinal support and it also reduces your breathing. Since you're slouch, you reduce your lung volume and the expansion of your thoracic or the lung or the rib cage to get a complete breath. So if you actually notice, if you see your patient or yourself anytime anxious, you are breathing shallow. So breathing, taking a full breath is important to realize that you're not breathing properly. Also, we all have a wrong pattern of breathing wherein we use our abs in a wrong way while we are breathing. And this has been seen very commonly in physio OPDs now. Why that is why we also call it as paradoxical breathing. So if slouched posture not only reduces your spinal support, but also affects your neck, which leads to increased load on your lower back. It affects your shallow breathing as well. And this body compensates for all of this by tightening the muscles, which is leading to dull, persistent pain, especially morning stiffness. And this is not easy to resolve even though you're taking muscle relaxant or a painkiller or not doing exercises in general. Then there is something that we also called as overcorrected or rigid posture, in which the person tries to, especially gym goers or people who have bulky muscles, they try to correct their posture and they are rigid. So this is the other extreme when people are holding themselves very rigidly. Constant muscle holding increases the mechanical stress on the joint, on the muscles, and prevents the natural rhythm and movement, which is leading to pain. So this pain is more of fatigue induced due to holding and eventually giving weakness rather than just the weakness or not in sync. So the truth about dynamic posture is your good posture is there is no single posture that is good or bad. So if you are using a standing desk, if patient is using a sitting posture with the highest good quality, say the richest chair possible in the market, but yet coming to you with a low back pain, it generally is because the patient is not moving. So anything that is dynamic, anything where people take frequent breaks, anywhere where they maintain good hydration, good stress, so they can manage their stress. Good stress is what I meant is they manage their stress better and have good sleep. Actually leads to better pain relief than just exercises or physiotherapy or medicines alone. So there is the body thrives on movement. We are meant to be dynamic and variable. Comfortable, relaxed alignment with movement is very healthier than holding on to any posture rigidly. So be it sitting, standing, lying down, using laptops from your home or anything else. So how does stress play into this? So when we experience any stress, the body automatically enters fight mode. Muscles tighten, your breathing pattern changes, your nervous system is always alert. And this happens even if we are not consciously aware of it. Also, when you're holding on to the stress, your body reacts. So, to the doctors here, the fascia retains everything. Muscles don't, but the fascia does. And to the patients, fascia is nothing but the muscle covering, which is connecting your body to each other and between the fascia and between the muscles and bones. So any trauma, any stress, any psychological impact that is affecting you, the fascia remembers. So even though if you're trying to let go, it is not easy to let go. Okay. It is always difficult because your fascia is always remembering and it is not letting go. So it is important for you to practice mindfulness. You practice reduce the stress, be it your job, be it emotional, psychological, physiological, or biomechanical on the muscles. And this can be only done when you're consciously aware of it, because something like stress, even in a minute thing, say, I forgot to order something, or the patient is very restless even when giving history. So such small note observations, actually we can figure it out that patient is stressed and not consciously aware of what impact it is having on the patient's posture or the pain. So when we get consciously aware of the stress and its impact on the body and posture, it changes our perspective towards the uh, stress management, and that's when we start thinking from stress and pelvic floor connection. So connection between the stress and pelvic floor is how your diaphragm and pelvic floor relationship impacts everything. So pelvic floor closely follows your diaphragm. Diaphragm is nothing but the breathing, as I told, the roof or the umbrella shape structure that keeps your lungs in place. So pelvic floor is closely following your diaphragm. So when the breathing becomes shallow, which is generally seen during anxiety or stress, the stress might not just be emotional stress. Your pain is also considered as stress, a physiological one. Your pelvic floor also increases the tension. So tension in the pelvic floor also tends to increase over a time. Chronic stress leading to chronic muscle guarding, which is your nervous system not allowing you or resisting you to not letting go of the tension. And then this results in pain because of the constant holding on, constant guarding. So sometimes when you go for any treatment like physiotherapy or any other, be it allopathy, homeopathy, Ayurvedic, you might see the pain coming back. That is nothing but your nervous system reacting strongly to the body or to the intervention that you're trying to give. So your nervous system doesn't want to let go of the guarding because you have not actually connected the dots and treated what the root cause is. Hence, it is very important to have that while you take the history or while you give the history, to mention the mind and body connection. Okay. So emotional stress, physiological stress directly alter your muscle tone and pain perception. This explains why many patients experience pain without major findings on the scan. So, if you feel that you have got x rays done, you have got CT scans done, you have got MRIs done, but still the scan is completely normal, yet you see that they have pain. They'll insist, yes, there is pain, and the movement is increasing it. Morning, the pain is triggered. I'm unable to sleep. So, there is a huge dislink between mind and body when this happens, and that pain is not imaginary, but it is very much nervous system driven. So when a pain becomes chronic, so when all muscles start to fail to fully relax, basically they alter the biomechanical chain. The nervous system stays very overprotective. Pain persists even after the tissues have healed. So tissues healing, once you start exercising, once you start taking the proper precautions, they start healing, but your nervous system starts to resist, and then the body remains stuck in a protective loop, where the loop is nothing but a vicious cycle. So if you do any movement, the pain is triggered. There is a fear of doing the movement in the first place. That fear will increase the stiffness, and again that stiffness will give pain. That pain will again give rise to the fear. So you're stuck in that vicious loop, and to break through, you have to treat not just your body but also your mind, also your pelvic floor, and along with the entire core. So from acute, subacute to chronic, you have to maintain a chronology to assess how the pain has reached to this level. So it can be a load issue, as we physios call it, so where the weight is not put in properly, or the muscles are weak or tight, but it can as simple as that be a stress issue as well. Okay, coming to it, why treatment fails. You often ask this, कि doctor मैंने तो सब किया है, but still the treatment isn't working. So I've tried everything, yet the treatment doesn't work. Treatment often fails when we focus only on the pain side, or rather just treat it symptomatically and ignore the postures, your breathing, your stress, your mechanical loading principles behind it. Also, without addressing all these, the relief is usually temporary. So you might feel you're getting better, but the pain, say down the lane with three months, 6 months, start coming. Whenever there is a seasonal change, patients often come back with the same pain, same side. So this is actually when it is only treated, when you only treat the pain and not what is causing the pain. So posture, your breathing, your stress is very much important while you give the history or take the history. So what actually helps healing? So healing improves when we focus much on your awareness, consciousness, self-awareness rather than the force. So gentle posture awareness, how you're supposed to carry yourself, either be it sitting, sleeping, or walking, driving. So your posture awareness, your breathing patterns to be corrected, retraining your breathing muscles to do their function only and not you some secondary action that they're not supposed to. Pelvic floor coordination. So coordination between your pelvic floor, your abdominals, your diaphragm, and your back muscles is very, very essential, especially in females, especially post pregnancy. If they are having the pelvic floor assessment post pregnancy is very important when taking a history. And the stress regulation. So unless and until you regulate the stress, physiological, emotional, psychological, or biomechanical, it is not going to heal. So these are the breathing practices that I generally have seen people do and it helps them. So guided diaphragmatic breathing, it's nothing but where you do, all of us can do a short breathing. So we sit comfortably, just try everyone. Sit comfortably, place one hand on your chest, one on your abdomen. Inhale slowly through your nose. Feel the abdomen expand when you're inhaling, and while exhaling, your abdomen should go in. So breathe in, abdominal expands, breathe out, abs in. So this is the correct way of breathing. But if you're doing it, you will notice that everybody of us is actually doing it in a wrong way. We end up doing the opposite. And this first stress management starts with the breathing practice itself. So again, just a simple trip whenever patient comes to you or whenever you are yourself anxious or overall you want to improve your focus or concentration, just breathe in with your abs out and breathe out with your abs in. Okay. Then there are pelvic specific posture reset exercises as you can see in video. I hope everyone can see the video. You can just, some of you can comment in the chat if they can. Is the video seen?
Yes, doctor, we can see.
Yeah. So these are the basic core activation and pelvic floor activation exercises. So as you can see, these are all essential, be it men or women or kids, even the adolescent teenagers, to do all this because this is going to help them build a strong foundation which can prevent low back pain in the future. And as you can see, it is not just low back, but also your neck and upper back, mid back, which is going to get affected because it's a domino effect. So, what are the daily habits that you have for back and pelvic health? So, small daily habits can actually make a big difference. Just avoid long static sitting, keep changing your postures frequently, take micro breaks, breathe calmly during stress, during anxiety, avoid constant muscle holding. So, while I do know there is lack of pelvic floor awareness, but since Instagram has created a huge buzz around it, and there are some people who go around Kegels, so overdoing Kegels is also not good in a way. So please always consult a medical professional, be it any doctor that you trust. And overdoing anything is going to result in constant muscle holding. So that's again not a good habit. So you should incorporate some of the pelvic floor exercises and some of the breathing exercises to bring back the sync. So this can be done at your desk, at your home, as warm up, as cool down, before or after workouts. So all this will give you regular breaks, regular movement, and bring in the sync back. So key takeaways is, Low back pain is a system level issue. The pelvic floor actually plays central role. Posture always should be dynamic. Stress strongly influences your pain and mind body balance. And just the consciousness or self awareness along with exercises is what will support healing. So this is how you should manage everything. It's not just the one singular approach is what you see and what you treat. It is what is not seen is also what we need to treat. And since this was a homeopathy lecture, I know you people do take deeper histories just like we do. But this is also why patient sitting right in front of you, as Dr. Archana had pointed out in her presentation, that just listening to the symptoms is not what can help patient, but actually observing the patient sitting in front of you, how the patient reacts, how is the patient tolerating movement, what are the special tests that are positive, and how when the pain started, if there was any history of neck pain or mid back pain or any operations or surgeries done in the past. So a detailed history along with the patient interactive participation is what we look forward to whenever there is a pelvic floor, especially a female in her 30s, in her 35s, asking about incontinence is essential factor if she's presenting you with a low back pain. If the patient is male above 50, you need to ask about prostate, frequent urination in the evening, in the night, because again that becomes a weakness of pelvic floor in males. And whenever you see patients like this, you can physiotherapy can does actually help. So you either reach out to your physio, or if you are a doctor, you can actually refer the patient to the physiotherapy yourself. So closing message: when posture and stress are addressed together, healing improves significantly. This is an integrated approach which supports recovery across all the systems of medicine. So thank you, and I'm very much happy to take the questions. Hello. Any questions, anyone? Yes. So, Dr. Yashika, Dr. Archana, thank you for recommending me. It was actually a group discussion, and it is always appreciated to have same-minded people and discuss it amongst themselves. And KHA, thank you for giving me this opportunity. It was a first time for me to present in front of homeopathy doctors, but yes, it was definitely helpful and definitely fun. Up to you, Dr. Yashika. Dr. Yashika. Hello, am I audible? Dr. Yashika?
Yes, ma'am. Yes, ma'am. Thank you so much, ma'am, for such a nice presentation. I would like to request everybody to please post your queries in the chat box so that we can discuss the queries. We had a very nice presentation by Dr. Sayalee as well as Dr. Archana. We have both of them with us. Please post your questions if you have any queries.
There was one doctor who was asking, I guess, Magdala. Yeah, she was asking me. So, questions if you have, please be vocal about it.
No, ma'am, that was not a question. I think she was asking, is it possible to send another question to you, Dr. Archana? But
Yes.
she didn't post the question. Maybe
Yeah.
in personal, she has posted it to you.
No, there's nothing actually in personal.
Okay, okay.
Yeah. Fine, we can wrap up if things are
Anything you
done.
want to share, ma'am, you can share by the time, if whatever query she asked you prior.
Now, we had a wonderful session with Dr. Sayalee. Actually, she had given such insights about pelvic floor and posture and all, which definitely will help all the audience in breathing and all. Like, these are such small, small microscopic changes if we make, we can definitely have a lot in that. So I think there is nothing, nobody's typing anything, right? Aside of beautiful description of the cases. It was a beautiful set of slides. Are them out of the book? No, they are not out of a book. I had used AI also in this, and as everybody is using, so little bit of software conscience, science with dealing with the software and how
तो
to
ये
find
सैटरडे
out.
संडे ऐसे ही रहता है हम लोगों का ना मीटिंग वगैरह सब संडे बैठते हैं ना
You are on unmute. Okay. So yeah, this is all through these slides that I have taken. I have taken it from the HomePath software and the correct use of the software. So as the reason of which I was able to make these slides. I hope, Magdalena, your question is answered. If you have any other questions, please let me know. Yeah, thank you so much for attending, and I hope everybody enjoyed the session. Please give your feedback and also see uh, some link that Dr. Yashika has sent on the chat box.
Thank you, ma'am. I think she, Dr. Magdalena, is asking you a query
Yeah,
regarding the
more cases.
cases from your practice.
Yeah, sure. We can have sessions if the time permits and we can see more cases. But meanwhile, you can also write back to us like what kind of cases you are interested in, and accordingly, our study group can work on it.
Thank you so much, ma'am. So now I would like to share our greeting for our speakers. We are thankful to them. They have spared their precious time with us, and beautifully they have explained whatever the topic, the warts, and how to deal with cases in warts whenever your patient comes to you with warts, and how physiotherapy and the pains and different types of pains can be covered. So we are thankful to both of them. So I would like to present the certificate to our first speaker, that is Dr. Archana Suresh Khade, ma'am. She thank you for being an honorable speaker with us on of Ka Homeopathy Study Group, ma'am. Thank you so much. On behalf of the whole Kavita Holistic Approach, I want to thank you. Also, I would like to thank Dr. Sayalee Pete, a physiotherapist who has been an honorable speaker of today's webinar with us. So, thank you so much, ma'am. Thank you, both of you, for sharing your insights with us. And now I would like to request anybody if you have any questions. I think there is one question uh, for the from Dr. Brenner only. From the back presentation, similar questions she's asking of learning more of breathing and home exercise. I think, ma'am, you can personally contact ma'am for the same, and we can have a discussion. You can have a personal discussion with her, or we can organize another webinar for the same. Thank you. Also, in the end, I would like to introduce you to the introduction of the study group pro bono. that was already discussed in the starting before starting the webinar. It was already introduced to everybody. So, Ka Homeopathy Study Group was organized and founded by our homeopath and humanitarian Kavita Kukunur ma'am, the president and CEO of Kavita Holistic Approach, on May 5th, 2020. The study group is intended to be an offering from Kavita ma'am to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for the CAR. CAR's mission and vision are very unique to inspire young homeopaths, mentor, and provide excellency for educational purposes using holistic approaches via webinars, which are based on the principles of classical homeopathy and provide professional, continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita Kukunur is also a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She's nationally board certified by Council for Homeopathic Certification (CHC) and HNA CPD provider, and serves as an associate editor for Homeopathic Heritage. She's a NASH mentor for North American Society of Homeopaths and lifetime member of NCH, that is the National Center for Homeopathy. She's the recipient of Martha Oilman Community Service Award by the National Center for Homeopathy and Best Print Entrepreneur Award from Dr. N. Lingaraju, sir, the principal of JSPS Homeopathic Medical College, Hyderabad, India. Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night or Out or October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopathic Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA, Mr. Harbhajan Singh Cheema, the ex-director Homeopathy, Government of Uttarakhand, and Chairman of HomeoCare Cure and Research Institute during National Homeopathy Seminar at Kashipur on 21st August 2022. So we have our members, Dr. Rajneesh Sharma sir, the CAR advisor, Dr. Shweta Singh, the CAR chief administrator. CAR team was also recognized and presented with legendary homeopathic award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA. Is also honored by renowned DTU, the Detroit Telugu Association Executive Committee on Mother's Day at Michigan, with DTA Community Service Award. She has achieved Lifetime Achievement Award 2024 by HomeoCure and Research Institute Director Dr. Rajneesh Kumar Sharma, Ka Homeopathy Study Group. We are extremely happy and proud that we celebrated 14 years of her book, Beyond the Limits, a challenge to prove oneself, and her second book, A Dose of Spirituality, with Kavita, has also completed 3 years on 22nd Jan 2025, which was launched in presence of Honorable Guest of Speakers, American Institute of Homeopathy, President Dr. Alex Baker, and Council for Homeopathy, President Dr. Sheetal Tiwari at a CAR webinar. At a CAR second annual celebration, our honorable guest of speaker was Dr. Jawar Shah Sam, the chairman of Enlightenment Education, who launched its audio version and hard copy. We have donated over $1,500 to 15 charities within 1 year, which is also listed on the website. As of now, we have nearly 610 recordings on professional webinars related to homeopathy, health related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by me, Dr. Yashika Arora Malhotra. And we are thankful to all of you for attending our scientific session. Thank you so much, audience. We would like to end the webinar for today. See you all for the next webinar the next month. The details will be shared in the group as soon as it's ready. So thank you so much to the speakers. Thank you, audience, for being with us.
Thank you, Dr. Yashika.
Thank you, Dr. Yashika. Thank you, Dr. Archana.
Thank you, Dr. Sayalee, and thank you to all the audience who has been there till late night with us.